Welcome to the Holistic Self-Love Podcast. I'm Elizabeth Vallejo, a life coach here to help you build healthy habits for real change. Join me as we explore practical ways to reduce your stress, find balance, and feel your best every day. Welcome back to the Holistic Self-Love Podcast. I am so excited about this guest in this episode because we are talking about menopause, something we're not used to talking about. I'm about to be 43 years old. My mother wasn't spoken to about menopause, and my grandmother wasn't. And even now, I feel like I'm learning as I go with the women that are older than me, like the mother figures in my life. Like we're learning about this together. So I had the fortune of running into this incredible endocrinologist. Her name is Dr. Pignanelli. Her first name is Marcelle. She was a guest at our retreat at the Anchor. And when I met her, she just lit up when she talked about women, when she talked about hormones. And of course she did, because she specializes in menopause. She specializes in hormones. And that is her dream, is just to help us and to talk about it. So on this episode, I know this episode might not be for you, but I know you know somebody who is going through this or will be going through this. So please feel free to share this episode with whoever you think needs to hear it. But if you are here and you are ready to sit down with us for the next 30 to 40 minutes, you are going to learn what to look for when we're going through menopause, what we can do to help guide us through menopause, what are some myths, some things that we are just hearing on replay on TikTok, what works and what actually doesn't work. And I am just so excited to sit down with her. And I know this is going to be one of many episodes that we talk about this, because she is just a wealth of knowledge. She's also very in tune with your body. And she's one of those doctors that doesn't want to throw medicine at everything. So sit back and let's learn about menopause together. Okay. Marcelle, thank you so much for being here in the Holistic Self-Love Podcast. I am so excited to interview you because we are going to be talking about something that I did not grow up talking about. I don't think my mother grew up talking about, let alone my abuela grew up talking about. And we are going to be talking about menopause. So I know it's a hard word, but you happen to be a specialist on it. So tell us, why are you here? Who are you? And why are you so knowledgeable?
Of course, of course. Well, thank you so much for having me. I think that this is a great opportunity for me and you to talk about things, share to the world what we know about self-love and integrating, science, medicine with it, because I like to think it's a combination of both, right?
Yeah.
Um, and I am an endocrinologist, so I specialize in hormones. What I do is I did internal medicine residency first as a general doctor, then I specialized in endocrinology, did fellowship for 2 years. I work as a full-time endocrinologist in New York City. Come visit me. And so I see that full time, and I treat everything from having to do with thyroid, your pancreas when you have insulin resistance, such as diabetes, polycystic ovarian syndrome,
Wow.
which is common in female reproductive age. I also treat adrenal glands. So yeah, it's a little bit about what I do.
So you are our menopause expert. That's it. You are the podcast menopause, all expert on all things that are girl. Because
Yes,
we're just girls over here. So
we're just girls.
we're just girls. So the fun part about being just girls is that I met you on a women's retreat. It was my only second women's retreat that we hosted at the Anchor, and it was so great to see you as just a girl. But what I loved about meeting you is that the moment you started to open up about all of this, your eyes lit up, and I was like, "Oh my God, this woman is living her dharma." And I love that your dharma involves science and medicine, because as a life coach, I want to tell you the spiritual reasons, because I'm a little spiritual, but I also am very science-based. I want to tell people why. So my first question, because we're on the Holistic Self-Love Podcast, has to be, what is the correlation with self-love and the hormones and how it affects us? Like, why are those
Yeah.
two so connected? Because I don't think that people really get that. I mean, right before you, I was in a therapy session because as a life coach, I need a therapist. I love my therapist. I think she's my best friend. And she always ends it by asking me, "How are you going to love yourself today?" And as a life coach, sometimes I'm like, I don't have time for that, Kelly. But it really is important. So can you tell us a little bit about why it's so important when it comes to all of our hormones and everything?
100%, yeah. So that's a great question to start. I think that being able to really take care of yourself, and that has many meanings, right? Depends. It means something
Mm.
different for everybody.
Oh, yeah.
So, but the feel good hormones, which are dopamine, serotonin, endorphins, oxytocin, those are really good. Those are hormones that you feel in moments of happiness, when you're sharing moments with friends, with family, when you're in community, when you're doing something good for yourself, like movement. The saying
Mm.
movement is medicine. You release a
Yeah.
lot of endorphins when you work out. So I think being able to have those peaks of hormones within your body propels you to want to continue to take care of yourself. If you haven't started, then maybe start. Also, another thing is the number one cause, but after heart disease, of morbidity and mortality, a fancy way of saying the number one cause of death in the United States, is cancer. And
Wow.
being able to take care of yourself by going to your doctor visits, going to your screenings, eating healthy, how whatever that means to you, if you're a vegan, you're vegetarian, whatever, if you're not any of those, but you still eat everything, eating a diet, a very healthy diet, as well as moving, that all influences chances of developing diseases later in life.
I love
Um,
that. And
yeah,
what I loved is that you were a doctor that went to a retreat to take care of herself. And you even said it like, I did this because I needed it. I was burnt out. I need to make a big decision and I needed to clear my mind. I needed to not work and not see clients. So to me, it's always beautiful when your doctors are doing what you do, because I think you've
yeah,
seen it a lot, that there's a lot of doctors that have very unhealthy habits. They're just based on pharmaceutical and they just want to give you a pill for everything. But anytime I ask for your advice, you say a lot of holistic things. So it leads me to believe that it really is important. It's more important
it's
than people
very
understand.
It is. It is. I completely agree with you. I think that, you as a doctor, practitioner, you want to model what you're trying to preach to your patients, right? Because if I'm sitting here and I'm like, you can't eat simple sugars, you can't eat fried foods, and then I have, you know, fast food every day for lunch. I mean, I'm kind of like being a bit not a bit, I say very hypocritical, right? I'm
Very
being
hypocritical.
yeah, super hypocritical. I'm not practicing what I'm preaching, and I want to, as someone who promotes health and wellness, I have to model what I that for my patients. Which is what I try to do on a daily basis. I tell my patients how important it is, and I really try. I really try my best to. So yes, 100%. I definitely Your retreat definitely helped me take care of me, and you and your family took care of me. So yeah,
Well,
yeah,
that is our goal at the Anchor, is like, how do we take care of you? Because, it's an investment. You invest. I had this conversation with someone today where they kind of complained about how wellness is so expensive. And I almost wish that a lot of it was covered under insurance. But the reason it's not, and me and you have spoken about this, is because I can't do anything in 15 minutes for anybody. Like, that doesn't work like that. When I go to my naturopath, I'm there for 2 hours with this man, 2 hours. So I don't think people really understand, like, if we could do this for free, we would.
yeah,
All of like lifestyle and wellness and like people that want to help you, we would, but this is our
yeah,
full-time job. So
yeah.
it sucks that we live in a society that it is such an investment, but I do think
Hmm.
that things like retreats are huge investments. Like, they're friendships you're going to get for the rest of your life. They're connections, like you said, how community is so important. So what I wanted to ask you was about stress and burnout.
Yeah.
Why is that get us so out of balance? I don't think people understand, because some of us are so chronically stressed. It's almost what we're used to, that even when things calm down, what our nervous system does is go, okay, what can we stress out about next? And we don't really take that so seriously and into consideration that this is like not helping us when it comes to our health. So why is that?
Mhm. Yes, yes, excellent question. You know, stress, burnout, emotional trauma. These are all things. So first off, I guess I'll start with the physical signs and symptoms that you can sort of experience when you're experiencing these things,
Mm.
and that would be weight changes, insomnia, um, acne, tiredness, but like perpetual tiredness, never feeling fully
Yeah.
rested, low sex drive. Sexual health is super important, and we don't talk about that enough. So, low sex drive, menstrual irregularities, hair loss, um, irritable bowel symptoms such as diarrhea and or constipation. So these are all signs and symptoms that unfortunately Western medicine has not completely caught on to what to do
Wow.
about them. Like we know how to treat certain tumors, we know how to treat a good amount of cancers, we know how to treat, a lot of things, obviously. But the amount that the stress, burnout, signs and symptoms on the body are absolutely tremendous. And I have such a huge amount of patients that come to my office and are like, I'm feeling this. I've gone to every single doctor. You are my last stop shop because I
Wow.
really don't know what else to do, you know?
Yeah.
So that all circles back to self-care,
Mm.
circles back to taking care of yourself, being proactive, hydrating, you know, also, um, intellectually really keeping up with trying to learn something new, that is super important for health as well. So all these things stimulate your brain, stimulate the way you think, help you really keep your health in check. So yeah, it definitely can imbalance, your system, and that's why you have accountability partners such as those you meet at your retreat.
Yeah.
And in general, just family, friends, that can keep you accountable and be like, "Hey, I noticed you've been sick lately a lot, or you've called out of work a lot lately.
Mm.
What's going on?" Things like that.
Also, just to be clear, your accountability partner can't be the girl you're going out with to drink every weekend and doesn't work
Yeah, no.
out and doesn't eat right. That is not how that works. I
It's not your
try and
hinge date.
tell No, I try and tell my clients, like, our partners and our best friends are not qualified to do that. Um,
Yeah.
but I do wanna talk about, in the spirit of we're just girls, so many of those symptoms that you talked about is just me not feeling good and going, "Mm, it's probably just because 'cause I'm a girl. It's probably just because I got my period." Like, is that period diarrhea or is that regular diarrhea? Is this normal? Like, I remember you telling me once how we're just unwell for, like, 2 weeks out of the month just in our
Mhm.
cycle. So how can we
Mhm.
tell if it's us just being a girl or if we're actually going through premenopause?
Yeah. So, that's very, very interesting point. So, one thing you want to notice, so in the perimenopausal, just to establish definitions,
Okay,
menopause
yes.
is 12 months without a menstrual period.
Okay, so
12
12
months
months.
without you have from it's been 12 months since your last menstrual period, that is menopause.
Okay.
Perimenopause, perimenopause, that's declared as menopause. Perimenopause is when you're having irregular periods. And what are irregular periods? Irregular periods are periods that are less than 21 days apart or longer than 35 days. So if
Like,
you're
they last longer than 35 days?
So if you have your period every 21 days, less than
Okay.
every 21 days, let's say every 17 days you get your period,
Oh god.
that's considered an irregular period. If you get your period every 36 days,
Oh, thank god I
that's
misunderstood. I thought you were saying we were gonna have a period for that many days, and I was just like,
no, 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 that's
"I'm
not how
done
it's working.
here. We're done on this planet. Like, I've done everything I can. I cannot go through that." Okay,
Yeah, no, no,
so
no.
okay, irregular
Irregular
periods.
periods. So
Mhm.
irregular periods is probably one of the biggest indicators as to why you're going not why, excuse me, as to you're entering perimenopause. So
Okay.
irregular periods, temperature intolerance. What I mean by that is either cold or heat intolerance, where you're like sweating up a storm, and
So
everybody
hot
else is
flashes
feeling, yeah, where
where you're
everybody else is
dying.
feeling normal, and you see everyone else is feeling normal, and you see everybody, and you see yourself like, okay, I'm burning, and I'm literally sweating. My pits are like super wet. Like, what is happening? So that's one. Insomnia, and like insomnia is a dicey one, and the reason why is
Yeah.
because everybody has insomnia. We are attached to these things
Yep.
and we don't know how to let them go. The blue light from these, devices just keep us up at night. They alter
Thank
our
you.
brain waves. So sleep hygiene is, I can't stress it enough. If there's anything I'm going to stress today, it's going to be sleep hygiene.
So we need to get
Um,
what I'm hearing is we need to get our sleep together. So when we are going to start going through premenopause, we could actually identify it because I mean, the culture that I'm in, right? My daughter's in high school. Just
yeah,
yesterday at a 2-hour meeting, they were making a joke about like, we don't sleep. This woman was like bragging about how she sleeps 3 hours a night. And I'm just like, okay, you're a mom, you're not a life coach, shut up. But like we need sleep. It's so important. Like, and
it's
how are we
so
supposed to know
important.
we're going through premenopause if we're just perpetually not sleeping?
Exactly. So the hot flashes, insomnia, increased anxiety, and palpitations. Palpitations are when your
Mm.
heart's beating really fast and you feel it in your chest. That these are all signs of depletion in estrogen, so that your
Oh,
estrogen's going
wow.
down. They're called vasomotor symptoms. That's what the Menopause Society and what we call it in medicine. So low sex drive is another one.
Okay.
Vaginal dryness is another one. So these are all signs and symptoms where you're like, okay, you know what? I'm past 45. I'm 46 now. I'm having hot, I'm sweating up a storm. I'm not sleeping well. I have palpitations. I have low sex drive. My vagina feels like paper, you
Oh,
know,
Lord.
time to go get checked.
And the beautiful thing
Yeah,
is there's so many products out there now that we can use. Yeah, we didn't get like, I'm about to be 43. My mother never really spoke to me about it. Her mother never spoke to her about it, but there is a lot of conversation out there now. Like
yeah,
I believe that like by the time my daughter goes through it, she's going to have so much more information and there are so many I think the last time I spoke to you I was telling you about Naomi Watts had a vitamin line, a supplement
yeah.
line just for women and menopause and for all
Mhm,
these things that you're talking about. What do you
yeah.
think are like some pieces of advice that you could give women that are struggling with these things? Do they immediately go to their doctor? Do they wait until they don't have their period for 12 months? Like, is there something we can do? I don't know. I feel like there's, just recently I got all kinds of collagen injected in my face, changed my life. I get Botox all the time. Like we can stop that aging. I know we can't stop menopause, but it's 2025. Okay. Is there any way that we can make it easier to go through
Yeah.
this?
No, this is true. I mean, I think the no, you don't have to wait to have to be in menopause to see your doctor. Definitely don't. I don't suggest that. I do suggest going once you start noticing these systems consistently, because you can
Okay.
have weeks of insomnia where, like, I've had such a stressful day at work, or you have a child and that child's not doing well in school and that has you really stressed. And
Yeah.
we all go through stressful times, right? But if you notice something consistently, as in, 3 to 6 months of these things happening, then I do suggest going to your doctor, getting your levels checked. We check normally for estrogen levels, progesterone, LH, FSH. Mostly LH and FSH. Those are the main indicators. They're going to tell us if you're in menopause or perimenopause or not. But I do want to stress that perimenopause, menopause, they're clinical diagnoses. They're
Oh,
not something
wow.
that they're not something that you necessarily do with just the blood test. You can't just do it with the blood test. You have to ask the
Okay.
patient a series of questions. Someone should be asking you questions such as, how have you been eating? How have your bowel movements been? How's your sex life? How's your vagina down there? Is she juicy? Is she not juicy? We
I
we want
love
to
that.
ask all those questions. And another thing is cognitive behavioral therapy is also
Mm.
therapy is actually cognitive behavioral therapy is actually first line for a lot of the menopause symptoms.
Oh my God, tell me
And
why. I need to know why because I tell all of my clients that this is the type of therapy they need. People think that every therapist is good for you. No, there's people that
no,
specialize.
no, cognitive behavioral therapist. So I have one myself, love my therapist. So
Amen.
amen. So it's been shown in studies that if you go into menopause with a positive outlook on life, your symptom management is gonna be better. Isn't that
Oh my
crazy?
God. Well, because you do realize the suicide rate is so high in women that are going through menopause. I don't think, again, that we talk about this enough. Like we have Viagra and all sorts of stuff because God forbid a man doesn't have a boner, but these women are literally fighting for their lives. And, so much of our girlhood is you're just hormonal. You're probably going to get your period. So we get like conditioned into thinking that all these things that we're feeling is just because we're a girl, when really they're in menopause and it's a struggle. So I
Hmm.
love that you brought up the therapy. I always say, like, if I could put my dog in therapy, they would all be in therapy. I think
They
therapy
have
is so
dog
I think
therapists. They have dog
stop it.
therapists.
Stop it
Yeah,
because I'll
those
get
exist.
certified tomorrow.
Yeah,
Could you
I mean,
imagine?
please get certified so you can be my dog's therapist. I would love that. My
And then
dog
we
needs a
just
therapist stat.
Oh, and then we have a retreat just for dogs.
No, I would. Oh, that would be great. That'd be great. But
Like
yeah, no, that
a mommy and
exists.
me, a mommy and
Yeah,
me retreat where you take your dog to the Caribbean for a week. Like
yeah.
that would
Oh my
be
god, that'd be
amazing.
so nice. That'd be so nice. But yeah,
And
the yeah.
I'm
Go ahead.
also the biggest fan. We have a baby on my lap. This is our new baby, but I am
Oh,
such a
baby.
believer that they're so important. And like, yeah, if you can go into a stressful situation, just like, the cancer patients that are, their mindset's a little bit different when they do get diagnosed. It's a lot different than somebody who has spent their life being negative because a lot of people don't realize we're doing affirmations. We're just doing them wrong. We're doing them backwards. That's what
Yes.
I literally work on with my clients. That is what my whole journal is about, is affirmations and how important they are. So I love
Yes.
that you said that. And
Yeah.
I would love to know, how do you personally like practice self-love? How do you stay balanced? How do you do all of these things?
Yeah. Yeah. No, I definitely I go on retreats like at the Anchor. I do movement. I try to move every day.
Mm.
I go to the gym, I do hit cardio, I do Pilates, I do
Oh, love that.
yoga, hot yoga is like my ultimate fave. So I do movement, all the variety of movement. I try to eat healthy, green, I try to eat as healthy as possible. I also hang out with friends and family. I try to hang out with friends and
Mm.
family a lot. Especially living in a city, which is so ironic. I was actually talking about this with my boyfriend the other day. It's so ironic that in a city you feel so lonely.
Oh
It's
yeah.
such a huge city like New York, where there are thousands and thousands of people in the city that feel so lonely. And and we live on top of each other. Like I
On
can see
top of each other.
my neighbor, I can see my neighbor showering, like I mean, it's crazy. So being able to combat the loneliness, because one thing is being in solitude, another's loneliness, right? If
Yes.
you're in solitude and you're in bliss and you're enjoying your me time, that I love that for you. Amen. But loneliness, loneliness brings a lot of negative feelings with it.
Mm-hmm.
And and if you're in constant loneliness, that's going to impact your health one way or another. You tend to resort, if you're lonely and depressed, you tend to resort to unhealthy foods more. Like this is a
Yep.
scientific fact. You tend to crave unhealthy foods more. You tend to not move as much. So yeah. So I try to definitely move. I try to cook home cooked meals, rely on community, family, and friends, and yeah, and live my day,
Oh, I
sleep.
saw you. I saw you out there painting. I saw you out to
Yes,
dinner with the girls from the retreat. I love when
yes.
my guests go home. The good thing about you guys is you guys were all from the same city.
Yeah, we all
So,
live very close to each other, which is great. I know, and we none
yeah.
of us knew each other. I don't. Well, actually, Tanya and yeah, two of them knew each other, but
Yeah, and I love
um,
that because watching you guys continue that sense of community. Because I always tell the people at the retreat, like, you are going to get a dip in your happy hormones because you're going to get home and you're no longer in that retreat environment. And your
I
retreat
know.
environment, it's so safe and it's so loving. But the fact that you guys could keep that going and you went to, like, was it sip and paint?
We did, yeah. So Jess taught a yoga class.
Oh,
She taught us a I know. She taught us
love
a
it.
yoga class, and then we did paint and sip and just like ate takeout after. It was awesome. It was great.
Well,
Love
that's
them. Soul
incredible.
sisters. Soul
Yeah,
sisters.
love it. Because what happens is in retreats is you speed up the process of like friendship and like bonding. But I did want to
Yeah.
get back to what you were saying about New York because it's so true. I think, you're from Argentina and I'm Colombian. Like, you go to Medellin and there is no respect for your personal space.
No, none,
They
none.
talk to you really close. They're super cariñosos and touchy-feely. And
Yeah,
in Colorado, they're not so much. They're very
yeah,
much respect your personal space, but they want to know what you're doing this weekend. And
yeah,
I was raised in Miami. Like, why do you want to know what I'm doing this weekend? Like, are you following me? Like,
yeah,
immediately, I'm like, what is wrong with this person? But what I
yeah,
do notice in New York, as somebody that studies human behavior, is that you guys are really great at your personal bubble. You will be next to somebody in the subway and you don't even make eye contact. But the moment that you do, New Yorkers are some of the nicest people I've ever met. They will tell you where things are. They'll tell you their favorite spots.
yeah,
I remember at the retreat, Valentina, who is my assistant, who is incredible. One of her dreams is to go to New York, and she pulled out her like bucket list. And you guys were like, no, 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 we can go there and take a picture, but we're going to this cupcake place. That one
yeah,
sucks.
yeah,
We're
yeah,
taking you to eat bagels here. So it is that like breaking through that bubble. And then New Yorkers are like so nice because
yeah,
I when I saw you guys sitting there, I literally wondered how many times did they pass each other on the street or pass each other at the studio and didn't even notice each other. And now they've like opened up this line of communication and you guys are all stuck with each other for life.
yeah, yeah. I love them so much. I love them so much. And that is so important for health. You know, the number one, I find this fact really fascinating. The number one of the main requirements for you to get a transplant is for you to have a support system. It's one of
Oh,
the main requirements. You need a support system in order to get
I love that.
an organ transplant because you need the help. Like we need help. Like, you know,
Yeah.
we being this hyper independence
Mm-mm.
toxicity bullshit. To me, it's all bullshit. I mean, like, yes, of course, we want to be strong, independent woman who's obviously
Yeah.
like go off, girl, for sure.
Yeah.
But 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 we need each other. We need each other. It's so
Mm-hmm.
important for emotional, for mental, for physical health, for medical health. You know, it's so important, so important. So yeah,
Yeah.
100%.
When I was in my therapy session today, because it was like literally right before you, she was going through my goals for the year. And she said, like, what else do you want to get out of therapy? And I'm like, I just want to talk to you. I just need a safe place where like a really strong woman like you can just listen to me. I'm like, can you write that down? Like, I also had the pleasure of I'm my best friend's maid of honor, and we went to her bachelorette party. And I realized like the universe is bringing people like these really strong women into my life, just like your group and all my groups, where I get to like keep them. And maybe some people from my past, like maybe we've outgrown them because that support system is no longer positive. It doesn't make me
Yeah.
feel great.
Yeah.
I always say like your clients become your friends before your friends become your clients. I have
Yeah.
friends that I've had since I was 12 years old that don't even know what I do. They don't
Yeah.
understand it. They think I'm on vacation all the time. I'm like, yeah. Meanwhile, I was like in the, pantry crying and the guests didn't see because I was so overwhelmed and overstimulated and my pants were wet and I didn't feel good. Like they don't see that. They just think I have this glamorous life to
Yeah.
where I know you send me a really beautiful message the last time I was in a retreat and you were like, I know how hard you work. I hope you're taking care of yourself. And I'm like, and that's why I will keep her forever
Yeah, yeah,
because
yeah.
we
Taking
need the
care of
support
others,
system.
taking care of others, can be emotionally exhausting as well. Yeah, yeah. And having being able to water your plant every day with something is just it's so important. It's so important. I think being able to also recognize and have the self-awareness when you're like, okay, I need to go to the doctor and get this checked, or
Yeah.
I need to go and really take command of my health by doing fill in the blank. Being having that self-awareness is so important. So having people around you that can check you is very
Yeah.
helpful, but also really fostering that self-awareness within yourself for sure.
Yeah, I always tell my loved ones, like, do not tell me to hold you accountable unless you really want it, because this is what I do for a living. Like, I will be
Yeah.
on top of you. I will literally create a file for you, and then we're not going to be able to be friends. But
Yeah.
I do want to talk about this because I think this is really important, and I need as much as your expertise on this podcast. What are the 5 signs? So we kind of went over them. Can we go over them again? Because I want to make
Of
sure the
course.
listeners have them all. So, what are the 5 signs that you are literally transitioning into Premenopause.
menopause. Yes, of course, in menopause. So you say if you notice that you have irregular periods,
Irregular periods,
hot flashes,
hot flashes.
palpitations,
Ugh, palpits, and not just regular anxiety, like actual palpitations.
like yeah, it can be increased anxiety. It can be. It can
Okay.
be. We can group them: increased anxiety slash palpitations, and vaginal dryness.
Vaginal dryness.
Yeah, as well as low sex drive.
So I would like to say that there is a difference between I am too tired to want to have sex with my partner, which, by the way, ladies and gentlemen, we should be having sex in the afternoon. I don't know who made sex a nighttime thing, but we are so exhausted from everything.
Wait, what? You're not the first person to tell me to say that to me. I heard that the other day. Who said
On
that?
Mel Robbins. It was a sex
Wait,
therapist on Mel Robbins, and she was like, everybody should be listening to Mel Robbins. I think we should know that.
yes,
And
love her.
she not only was she talking about that, she said something that was so incredible, and we'll put it in the show notes because everyone should listen to this podcast, where Mel Robbins said to her, like, so I should be scheduling sex? And the woman responded, you've been scheduling sex since the moment you met your partner. Like, what do you think dates are? And I was like, oh my God, we've been scheduling sex our whole life. All of a sudden, now that we have long-term partners, like that's cringe. We don't want to schedule sex. Start having sex in the afternoon. It will change your life. I don't know who said we should have sex when we're bloated and had a couple drinks and had a full week. That is just
Mm,
setting us up for just so much disappointment. So there is
yeah.
a difference between I am exhausted and maybe we're having sex at the wrong time and then maybe I shouldn't
Hmm.
have ordered a burger for dinner than
Yeah.
no sex drive. So what is no sex drive?
So no sex drive is that you don't even think about it.
Oh,
You don't even think about sex. Like sex doesn't cross your mind. Like the idea just doesn't even doesn't even float up there. You're just not thinking about it. So, you're not thinking about it. You're dry down there. So you're like, eh.
mm.
So that's another thing very important to kind of differentiate. You can have vaginal dryness and because of that have low sex drive.
Oh, like because you're
But
self-conscious and it's just
yeah,
not
because you're
feeling
like you're
good.
like exactly. But you're like,
Mm.
okay, like, oh, I'm so dry down there. Like, what's going on? Blah blah blah. But it doesn't even make me want to have sex. But
Yeah.
then you have the other way around where you have low sex drive, and because of that, you're dry. So that's something that you kind of want to make sure and keep in mind. You're like, okay, so am I dry down there? Like, have I been feeling this way because I'm dry down there? What's going on? Let me try to get in the mood. If you notice the difference in moisture down there, these are all things you want to keep in mind. Um, there is something called genitourinary syndrome of menopause,
Oh my God, that
which
sounds
is
terrible.
basically low estrogen. Low estrogen causes thinning of the
Okay.
vulva area. So you have thinning of the vulva and you have thinning around the clitoris and then also around the urethra, because believe it or not, the clitoris sits right on top of the urethra. So you have the estrogen that keeps that area nice and juicy and moist when you're sexually active, also lubricates the urethra. The
Wow.
urethra is where your urine comes out. But when you're in menopause, not having that lubricated because you
Yeah.
don't have estrogen, you feel like you got to pee a lot and you got to pee every
Oh
other
my God. Like
hour.
we don't already have to pee a lot just being a girl.
Yeah, yeah, yeah. I
Okay,
have
so
to pee
what
every three
can we
seconds.
do for yeah, I just chalk it up to like it's because we're a girl.
Yeah.
What do we do? Because that sounds not only it sounds painful, it
Yes.
sounds like
It can be
now it's
very
gonna
painful.
heighten the sensitivity because if I'm not
Yeah.
lubricated and it's thin and now I have like urine coming down.
Yep, you're right. So there's different treatment options. There's different lubricants that you can use. There's also hormone therapy, topical estrogen that you
Mm.
can use in that area. Topical estrogen is the treatment of choice. Also, sometimes if you have and the best thing is to go to a menopausal expert, someone who's going to
Okay.
concentrate on menopause, who's going to examine you if you're having these symptoms. If you're having dryness, so I'll state them again: vaginal dryness, urinary hesitancy, urinary frequency, burning, and you've been treated for UTIs already,
Okay.
and you're still having these symptoms. there is a good chance you can be having genitourinary syndrome of menopause. So
So
you
from
want
what
to go
I'm
get
hearing,
checked.
yeah,
Yeah.
what I'm hearing is we could even in this process be misdiagnosed.
Yeah. Oh, 100%. Yeah. Hmm.
Yeah.
If you don't go to the right provider, yeah, you can. I mean, this is why it's important to really go to someone who does menopause. GYNs are the experts. Endocrinologists also do menopause. I do menopause. I treat a lot of patients with menopause. But the reason why GYN they have even more expertise is because they go through training where they have to do vaginal exams. Part of my training,
Okay.
vaginal exams is not part of that. But so if you're having genitourinary syndrome of menopause, then you want to go to a GYN rather than an endocrinologist. But if you're not having vaginal dryness, I have plenty of patients with menopausal symptoms that do not include vaginal dryness. They're just like,
That's
I'm just
incredible.
sweating up a storm, doc. I'm like, my
Yeah.
sheets are filled with my sweat. I don't know what else to do. Then yeah, I'm your girl. But if it's a spectrum, a total spectrum
Okay.
of symptoms, total spectrum.
So from what I'm hearing from you is listen to your body. Here are the 5 symptoms. Listen to your body and find someone like you that specializes in this and that's going to hear us as a patient, not just
Yes.
in and out. Go see this
No.
doctor. It's probably a UTI. Again, you're just a girl.
Yeah. No, go to someone who specializes in this. Because the worst that can happen is that, let's say they do run tests, they do urine tests, and they, do a vaginal exam, etc. They say, listen, everything looks good. I think you might have an infection instead, and they'll send you to the right person to treat the infection.
Yeah.
That's the worst thing that can happen. But chances are, by the time you get to this menopause expert, the chances are you've seen someone for the infection first, if you do have an infection.
Yeah.
Because that is the first stop you do to just like a general doctor to get treated for an infection. So
Well, I feel like I've learned a lot. I'm so excited that I had you on for this because I think there's a lot of things that we didn't really know. I mean, I knew about hot flashes and vaginal dryness, but as somebody that was probably born with anxiety, I'm like, I'm always just like, yeah, that's just my anxiety. That's just my anxiety, until somebody
yeah.
calls me out, like my therapist, and is like, well, is it situational? And I'm like, oh, wait, it was. But if it's chronic and it's not going away, and all these things that I've done in the last 9 years to cure my anxiety isn't working, then it has to be something else. Because what we tend to do as humans is go, this is what I always do. I always have anxiety. I'm always ruining everything. So this was really
Hmm.
great to know because I don't want to gaslight myself when I'm going through this. I would love to go in, how you said, with just so much positive energy. I want to be so like giving myself grace, saying, yes, you can continue to get Botox, but we're going to get gray. Things are not going to fall the way that they used to. We're not going to want to have sex the way that we used to. And how can we embrace that as women instead of shaming ourselves because we're already shamed enough as it is? You know what I'm saying?
100%, 100%. And it's important to also, another reason why it's important to get evaluated is because not everyone is a candidate for hormone replacement therapy. And you definitely want to fall under the hands of the right person, because if you are getting treated with hormones and there's contraindications as to why you shouldn't be on them, then that could be dangerous. It could put you in a sticky situation. So you want to definitely go visit someone that is has expertise in this area, because hormone replacement therapy entails, although relatively safe, there are contraindications such as history of breast cancer, history of uterine
Oh,
cancer,
wow.
the estrogen dependent cancers, estrogen positive receptor cancers, such as breast and uterine cancer, that you want to be careful. You don't want to use hormone replacement in these patients given their history, because what happens is if you feed them hormones, those cancer cells are going to multiply again. So
Oh,
you want to
wow.
make sure that you're the right candidate. That plus heart disease. If you have history of heart disease, and let's say, you have history of a heart attack, a history of a stroke, you want to be careful. You have high cholesterol, history of high cholesterol, and you're on a pill for it, you're on a statin for it. You want to be careful because also, estrogen can slightly increase the risk depending on the person.
Wow.
Okay.
Does the
Um,
hormone therapy affect your mental health? If like somebody's already struggling with mental health or anxiety or even like suicidal ideation, does the hormone therapy affect that?
Great question. And studies have not shown that treatment, I'm sure it does. I'm sure the answer to the question is yes, but
Okay.
studies have not shown that treatment with estrogen is going to necessarily help the mental component. What it does help is the physical signs and symptoms
Okay.
you feel, and by fixing that, your mental status is going to improve.
Okay, so but what we need to do for our mental state is community, self-care, positive talk, all of that stuff that we're kind of, thank God,
Movement.
yeah, movement, that healthy eating, that,
Hmm.
thank God society is waking up to, and it's so important because at my daughter's age, I didn't speak that way, and she speaks that way now. So to me, that's like so beautiful, which is kind of weird because their generation has the most anxiety.
Yeah, yeah, yeah,
But
yeah,
that is a whole nother episode that I'm gonna
yeah,
need you
yeah,
for.
yeah,
And
yeah.
I do love how you brought up the phone. When I talk to my clients that can't sleep or don't have anxiety, and they look at me and say, "Is it my phone?" And I'm like, "Well, it's not me saying it. It's literal studies. It's science. It's not me."
Yeah, yeah.
Um,
No, for sure.
yeah, and
For
it's
sure.
like if we already know that going into menopause, I'm gonna be more anxious, I can't add on to it. I can't add on
No,
more
no, no, no.
anxiety.
No,
So
no.
tell me what you are going to do now. Like, what is your next move? I see that you're so passionate about this, and I wish we were in the same city because you would be my doctor, even if I don't need you yet. Well, so we just get me
Yeah.
ready for it. What is next for you?
So I currently work at Mount Sinai. I'm working there for now. There's a good chance I might move out of state in the next couple months. So I'm trying to
Oh
figure that
my
out.
God.
Trying to apply for new jobs. But obviously once I know where I land, I will be letting you know. But yeah, I love seeing patients of all different kinds, you know. I think that I love to get the experience, the exposure, to be able to meet all different walks of life. I think it's really important as a healthcare, physician to really have that exposure. And it is something I'm very passionate about. I do have a page which I plan on working on. I just have a couple things to figure out by the end of this
Yeah.
year. But by the end of the year, I hope to get my page up and running. It's called Let's Talk Hormones, where I talk
Ooh.
all stuff about hormones. So yeah, no, for sure. I do plan on doing more of this work and being more outspoken. And I think one thing to mention that's very important, within the Latino community, we don't have that education.
Yeah.
And being that I am able to speak Spanish, and I really want to kind of be able to be a voice of Latina women in general,
Yeah.
to be able to kind of, because there's a lot of healthcare disparities between the Latinx population and whatnot. And I would love to, concentrate on that as well. So these are all things, projects, ideas, and dreams I have that I know will come true. It's just one day at a time.
I love that. I would really
Yeah.
love it if we could maybe culturally change that in the Latino community. We first of all, like, they get really low when they talk about it, right? So the women
Yes.
whisper and they go, es el cambio. It's like, it's the
Yes.
change. They don't say the word menopause. And you know what's so crazy about growing up as a Latina is I found myself doing that the other day. I was talking to one of my stepmothers and I go, "Do you think it's a cambio?" And I'm like, "Oh my God, what is wrong with me?" But I would love it if we were more open about that, you know?
Yeah, yeah. I mean, it's a natural part of life. I mean, you don't have to. It's not a secret. I mean, we're all heading there. And when you think
Mhm.
about it, the women of reproductive age is a very specific subset of population, like a specific population. We're only in this time for X amount of years, right? So, let enjoy them while you have them, and then know that it's what's gonna come, and then there's no reason to repel it. I mean, we can embrace it. We're all doing it together. We might as well, try to stick it out together. And yeah, I think, and also to bring it back, um, to what we can do to improve these symptoms, weightlifting in the
Ooh, we
menopause.
didn't even talk about that. That's why you need to come back on because I want to
Yeah.
do an entire episode just on supplements and fitness because there's so many misconceptions out there and people don't realize that, like, yeah, yoga's amazing, but you got to add stuff. You said something really interesting in the beginning of this call, and let's write this down for the next episode, was
Yeah.
that um about doing things to keep our mind stimulated. I don't think
Yes.
people realize that we start losing muscle mass and we lose it up here too. That's why, the Sudokus and all of those things are so important. So thank you so much for being here. You just got
Yeah.
yourself a part 2, so we will schedule that because we need more information. I'm just going to make you like our resident, like
I
all
would love
things for just
that.
being a girl. Like
Oh my
everything
God,
we
I would
need to
love
just be a
that.
girl. It's just you. I love your
Have me
face. I
whenever.
love you. Thank you so
I
much
love
for being
you.
here. And I can't wait to just post all of this in the bio and continue to brag about you. And thank you so much for being here.
Thank you. Thank you so much for having me. I love you so much. Obviously, I tell you all the time, you're my angel.
I know. And you were my favorite. Don't tell anybody.
I know.
She knew. She knew the whole time. Okay,
The
I
whole time
can't
I
wait
knew.
to talk to you again, and we're definitely going to do this again. I'm so excited, and thank you for all of this knowledge. I will link everything because I feel like if anybody has any questions, they could probably just reach out to you on Instagram.
For sure. For sure. Let's talk hormones. Please write to me.
Yes, I love that.
Yes.
Awesome. Okay, I'll see you next time.
See you next time.
Okay, now for the legal stuff. You know, the important things that I have to say.
This podcast is for educational and entertainment purposes only. I'm just a life coach, not a licensed therapist, not a licensed psychotherapist. This is not a substitute for advice from a doctor, therapist, or any other qualified expert. Got it? Great. See you in the next episode.